We all know the frustration of staring at a stubborn skin problem in the mirror. Whether it's an unexpected rash, persistent redness, or a sudden breakout, the desire to find something that works overnight is overwhelming. This is why Dermi 5 has become a staple of internet recommendations. It is often branded as a miracle solution because of how quickly it delivers visible relief to the surface of the skin. That speed creates a psychological trap. When the redness vanishes in hours, users assume the cream is a safe daily fix for everything from minor acne to uneven skin tone. This tube contains a high-potency medical cocktail, a far cry from the mild ingredients found in standard cosmetic skincare. Applying these chemicals without a specific diagnosis masks the immediate symptoms while triggering structural complications that remain hidden until the damage is already done. Understanding the damage requires looking at the components of a combination cream. These products are designed to attack several distinct medical issues at the same time. This diagram shows the internal chemistry. First, an antifungal agent works to destroy fungal organisms. Second, an antibiotic targets bacterial infections on the skin surface. The third ingredient is usually the most dominant, a strong steroid. Its primary function is to rapidly crush inflammation. This steroid produces the immediate relief users crave. By calming redness and reducing swelling and itching almost instantly, it provides a sense of cosmetic success that feels like healing. The mechanism behind that relief is aggressive. The steroid constricts blood vessels and forces the skin's localized immune cells to retreat, silencing natural warning signals. While the surface appears clear, the deeper structural layers become thin, fragile, and unable to support themselves. Because this cosmetic success depends on shutting down the skin's natural defenses, unsupervised use carries an incredibly high risk of long-term complication. The biological backfire begins when this immunosuppressive tool is applied to the wrong conditions, most commonly facial acne. The steroid reduces the angry color of a pimple almost instantly, while simultaneously clogging pores and triggering a spike in oil production. Over time, this leads to the development of steroid-induced acne. This is a severe condition that is far more resistant to standard treatments than the original breakout. When used for fairness or daily care, the consequences are even more visible. The delicate skin on the face begins to thin and weaken as it loses its natural density. This thinning leaves blood vessels permanently exposed on the surface and causes irreversible, uneven patches of dark and light pigmentation. After weeks of artificial suppression, the skin loses its ability to regulate itself. It becomes chemically dependent on the steroid just to appear normal. Relying on a medical cocktail for cosmetic guesswork systematically erodes the skin's structural integrity and leaves it unable to function independently. The breaking point occurs when a user notices these side effects and decides to stop applying the cream. This withdrawal triggers what is known as the rebound effect, where the inflammation that was suppressed for months is suddenly released into the tissue all at once. As shown, the skin rapidly flushes with aggressive redness and swelling. The original problem returns, now joined by extreme hypersensitivity and painful flaking. The search for a miracle quick fix often results in a recovery period that is significantly longer and more difficult than the original ailment. If this combination cream carries such risks, we have to ask why it remains a standard tool in dermatology. Doctors deploy the cream as a precision tool for specific infections, using it for short, strictly monitored durations. Casual, unsupervised use, by contrast, resembles a careless shotgun approach that ignores those vital boundaries. Availability at a pharmacy should never be mistaken for everyday safety. Powerful medications require professional guidance to be used effectively. A safer path begins with a proper diagnosis. Determining if an issue is fungal, bacterial, or allergic allows for a targeted, single-action treatment that solves the root cause without compromising the skin's health. Healthy skin requires patient-specific care. In the search for a cure, remember that the fastest solutions are rarely the safest.